Today I will be talking about men's health and men's psychology. Men fear losing the illusion of the invisibility. आज का टॉपिक टफ है, एक अनकंफर्टेबल मिरर है आप लोगों के लिए. Why do men ignore urinary cancer symptoms most oftenly? Is it ego, biology, or conditioning? Honestly, it is a combination of all the three, और ये combination dangerous होता है. Let's start from the biology. Now coming on to the urinary cancer, especially bladder cancer, का मोस्ट कॉमन एंड अर्ली साइन होता है पेनलेस विजिबल ब्लड इन यूरिन. Medical literature is very clear. 80 to 90% of the bladder cancer cases that we found in our clinical practice presents with painless blood in the urine, and yet most of men wait. Why? Because pain drives human to doctor, fear drives test, and urinary cancer mostly escape both in the beginning. Biology trick you by saying that silent. तुम्हें लगता है दर्द नहीं हो रहा, कोई भी सीरियस इशू नहीं होगा. साइंस कहता है पेन एब्सेंस इज नॉट इक्विवेलेंट टू कैंसर एब्सेंस. नाउ कमिंग ऑन टू द साइकोलॉजी ऑफ मेंस. Research across urological clinic worldwide shows a pattern. Men delay presentation longer than women in a urinary cancer. Not because they are careless, but because cultural programming runs deep. From childhood, boys often hear, be tough, don't make fuss, doctors are for sick people, and this very notions translate into illness is equal to weakness. So, जब first symptoms आते हैं, like blood in urine, sudden urgency, nighttime frequency, the reflex is not worry, it is a denial. शायद कुछ खाया होगा या कुछ पी लिया होगा या कुछ पानी कम लिया होगा, कल ठीक हो जाएगा, स्ट्रेस होगा, वर्कआउट ज़्यादा हो गया होगा. दिस इज कॉल्ड नॉर्मलाइजेशन बायस. ब्रेन रीराइट डेंजर एज ए टेम्पररी इरिटेशन एंड एड ऑन वन मोर लेयर, ऑप्टिज्म बायस, आवर बॉडी कैनॉट फॉल, कैंसर, अदर गॉट इट, नॉट मी. फिर ईगो क्वाइटली विस्पर्स इन मेन्स माइंड. डॉक्टर को बताने का क्या मतलब है? आई एम फाइन. स्ट्रॉन्ग मेन डू नॉट पैनिक. Science, however, is unemotional. Delay has a consequence, and a study shows that delayed evaluation of any sort of a blood in urine is strongly associated with advanced stage at the diagnosis and overall poor survival outcomes. Earlier, cystoscopy improves detection, stage, and survival. Bladder cancer is not very unpredictable. Late diagnosis make it look deadly. और एक और इम्पॉर्टेंट बात मैं बताऊं, men often misinterpret urinary symptoms as a prostate problem. So the self-diagnosis, Google-based reassurance that the PSA is normal, so everything is okay. एक single truth ये याद रखना, hematuria is not equal to prostate. Hematuria needs investigations for the bladder and the urinary tract malignancy. अब system factor भी होता है. Busy life, work pressure, social hesitations. Urine issue still feel private. Men talk about cholesterol very proudly. They whisper about urine and sex-related symptoms very casually. Science call it health-seeking delay due to stigma. Clinically, we call it lost time, and that is the time we have lost in delaying the diagnosis. And the biology says it keeps growing very quickly. Let's talk number without scaring you out, just facts. Bladder cancer in men is roughly 3 to 4 times more common than in females. Smoking, chemical exposures increases the risk very significantly. Single episode of gross hematuria, that is painless, visible blood in urine, needs structured evaluation protocol, urine test, ultrasound, CT urogram based on overall risk, and the cystoscopy in all those appropriate cases. Antibiotics improves the symptoms temporarily, does not rule out cancer. So early stage bladder cancer survival is very high when caught very early. Advanced stage, the outcomes drop very sharply. Let's rewrite the whole male script. Strong men does not go to doctors, but strong men does not gamble with health. Not if it does not hurt, it is not serious. But if blood appears even once in your urine, evaluate once. So here is the simplest rule I give to all my patients. If there is a blood in urine, at least one urological evaluation is mandatory. One, soon, not someday. No panic, no fear, just science, timing, and responsibility, because biology rewards earlier thinker and early diagnosis and punishes the late blabber. Thank you.